now. Hi, thanks for joining us for the today's workshop, Medicare 101. It's sponsored by the New Mexico Aging and Long-Term Services Department. Our secretary is Katrina Hotram Lopez, and I'm Chris Winterroad. I'm one of the SHIP coordinators for the state, and you'll learn a lot more about what that means in a couple of minutes. So I just want to let you know that this workshop is going to be recorded and posted on the Aging and Long-Term Services Department website. I'll show you as part of the presentation how to get to that easily. I'm going to ask you to keep, well, you can leave your camera on. That's your choice. Just know that if your camera is on, that people who are watching the recording in the future will be able to see you. And do keep your microphone muted unless you're asking a question. I'm going to take questions at the end of each section of the presentation. You don't have to wait until the very end. And since the recording, the workshop is going to be recorded and posted on the website, you will be able to go back and refer to what we've been talking about. Questions may be typed into the chat, or you can unmute yourself and ask. So today's workshop is Medicare 101. I'm going to introduce you today to a couple of really important consumer assistance programs, SHIP, which stands for State Health Insurance Assistance Program, and SMP, which is the acronym for Senior Medicare Patrol. We're going to go over the basic parts of Medicare, Part A, B, C, and D. We're going to explain Medicare enrollment, how to enroll, different things to make sure you're aware of in regards to Medicare enrollment, what your Medicare options are. I keep thinking that I'm going to take out the COVID updates, but then I keep not doing it because it's not gone and it really hasn't reached the endemic stage yet. I really do feel like we're still in the pandemic. And we're going to, if we have time, go over a few other resources that you might find useful. So the New Mexico SHIP program, SHIP stands, as I mentioned before, for the State Health Insurance Assistance Program. It's a federal state partnership. We're funded by grants from the Centers for Medicare and Medicaid, which is the federal agency that oversees Medicare. I get ongoing training at the national level, and I've even presented regionally and nationally. So we also get funding from the Administration for Community Living, which is another federal organization. We are contracted to provide expert, free, unbiased information and assistance for people who are, you know, trying to understand Medicare and make decisions about it. We provide counseling, education, outreach, and our information and assistance is accessible not just to Medicare beneficiaries, but also to their family members and caregivers. A lot of times as people age, family members start taking a larger role in assisting with medical care and decisions, and understanding how Medicare works becomes really important when people reach that stage. So we work with them as well. I mentioned before the Senior Medicare Patrol. That's the part of our organization that is tasked with helping Medicare and Medicaid beneficiaries avoid, detect, and prevent healthcare fraud. Seniors are, and Medicare beneficiaries in particular, are really the target of so many scams, and fraud is an ongoing issue. So we're going to talk a little bit about how to protect yourself against Medicare scams and fraud, and know that if you feel like you have been the target or the victim of a scam or fraud, there is some place to turn. We are tasked with investigating that. We report things at the national level because a lot of these things are not, you know, state specific, but cross borders and are a problem for people all over the country. So before we dive into the basics of Medicare, does anybody have a question about the SHIP or SMP programs? Let me just take a moment to let you know also a little bit about me. I have been a SHIP coordinator for, I don't know, 3 years, something like that. And before that, for most of my career, I was a teacher. So that certainly informs everything that I do. And you may, most people after a few minutes go, oh, that makes sense. So Medicare is health insurance for adults who are 65 or older, as well as younger adults with certain disabilities and anyone who has end-stage renal disease. It's really important to know that Medicare was not designed to cover all of your medical costs, right? And we're going to talk about the cost sharing and how that works as we go through the presentation. So when you turn 65, you qualify for Medicare if you are collecting Social Security or Railroad retirement benefits, or you're either a current U.S. resident and a citizen, or a permanent resident who's been in the U.S. for 5 years in a row. So that's the basic Medicare eligibility. You do not have to be collecting Social Security in order to get Medicare. And we'll talk about, many people that I talk to are opting to put off collecting their Social Security retirement benefit until it maximizes, until it maxes out at whatever age that is for you. For many people, it's 66 and 4 months, but it can be different than that. And we'll talk about what you need to do if you are not collecting Social Security yet. So if you're under 65, you may qualify for Medicare if you have received Social Security disability insurance for at least 24 months, 2 years. Once you've been on disability for 2 years, most people will switch over to Medicare. If you have ALS, there's no waiting period. You don't have that 2-year waiting period to go on Medicare. And the same with end-stage renal disease. Okay, so how do you get enrolled in Medicare? If you're receiving your Social Security check already when you turn 65, you're going to be automatically enrolled in Medicare Parts A and B. Okay, if you're not yet collecting your Social Security check, you have to actively enroll yourself on ssa.gov, or you can call your local Social Security office. But I really encourage people to go on ssa.gov because it's way easier and you don't have to, deal with trying to get through on the phone, which can be problematic. Your initial enrollment period for Medicare starts 3 months before the month you turn 65, continues through the month of your birthday, and extends for 3 months after the month of your birthday. So you have a 7-month initial enrollment period to get all those basic Medicare decisions made. If for some reason you miss that initial enrollment period and you don't get enrolled into Medicare A and B during that 7-month period, then your next option is to enroll during the general enrollment period. And that's every year. It's always the same. It starts January 1st and extends through March 31st. Currently, your coverage, if you enroll during the general enrollment period, is going to start on July 1. They're talking about changing it so that there's not that lag between when you enroll during the general enrollment period and July. That's a 7-month, it's a 6-month continued delay for people who already don't have the benefit. And I'm I mean, all of these decisions about Medicare are made by Congress in Washington, D.C. And so they've been talking about eliminating that period. I know CMS has proposed it. I don't know when that's going to take effect. Also, if there are a number of different special enrollment periods that you might qualify for once you're on Medicaid. For example, if you move, you get a special enrollment period. If you delay the onset of Medicare because you're still working and covered under your own or your spouse's active employer insurance, when that active employer insurance ends, you also get a special enrollment period to get your Medicare going. Or if you're entering or leaving a long-term care facility, you get a special enrollment period. Before we move on, does anybody have questions about Medicare enrollment? Okay. You can always stop me at any point. All right, so when you'll know that you're getting started because you'll get your Medicare card in the mail, and this is what it looks like. It's the red, white, and blue Medicare card. Your Medicare card is only going to have Part A and Part B on it. It is never going to have your additional coverage. And the reason for that is Medicare Part A and B are your basic building blocks for your Medicare coverage. No matter what else you choose, you're going to need to have Part A and Part B. And those aren't going to change, right? So the thing to note is, I mean, sometimes people have Part A but not Part B. Sometimes people have Part B but not Part A, and we're going to talk about the assistance that we can provide at your New Mexico SHIP program in helping you get those other parts if you don't have them. Yes, Laura.
I have a question because back on May 12th, I did my Medicare Part A and B, and I wasn't really concerned yet that I hadn't received a card. So should I have received my card by then, or does it wait till you turn 65? Should I wait till my actual?
Well, wait, let me ask you, what month is your birthday, Laura?
September.
Yeah, no, you're fine. So
Okay.
if your birthday's in September, we work it backwards. Your initial enrollment period starts in June. So June, July, August, those are the 3 months before the month of your birthday. So I would expect you to get it. If you haven't gotten it by the beginning of August, you might want to follow up. But I think you actually applied before your initial enrollment period if you applied in May.
Okay.
Well, have you received any communication from Social Security about it?
I got online, I got something that says apply for benefits, a re-entry number.
So you might want to use your re-entry number to go in and make sure that application went through.
Okay, and because the other thing then, I guess, and I guess it would depend on if my application went through or I just did it too soon, was that with the retired health education retirement, and I need to get this application in like in the next couple of days, and it says I need my Medicare number, and I'm like, well, I don't have it. I don't know how to find it when I don't have the other stuff yet.
Right. So Laura, let's talk offline after the workshop about your specific situation. But you bring up a really good point. So if you're a state employee, or you were a teacher, or you work for any state, city, county, or local government, you're probably eligible to get your Medicare coverage through the New Mexico Retiree Healthcare Authority. They do a seminar every month. If you haven't, and it was last week. I attend those to provide basic Medicare information, so I'm quite familiar with it. You may want to consider attending next month's seminar.
Well, I've done that. I've done two of them. The one last week is how I got your information. And I said, then I go, okay, that makes sense. I sit down and do the paperwork, and then I get confused all over again.
Yeah, and Medicare does that to people. You're not alone. So we'll talk more offline. So definitely, take down my information so that we can make an appointment. Okay. Basically, as I mentioned before, you should get your Medicare card. If you're collecting Social Security, it's going to come automatically. If you are not collecting Social Security and need to apply for it, you can do it starting at the beginning of your initial enrollment period, and then it should come within a month. If it hasn't, you might want to follow up with Social Security about that. You can always call them and they can provide you with your Medicare number over the phone. If you need help with that, we can provide that assistance as well. Okay, so here are the basic building blocks of Medicare. I think of Medicare as like a little Lego set that we can put together in different ways to make different types of coverage. So as I mentioned before, Part A, hospital coverage, and Part B, outpatient coverage, are the basic building blocks that you're going to need no matter what other choices you make. Depending on how you fill out your coverage, you will either have what we call original Medicare, which is Part A, Part B. You'll be getting those directly from Medicare. Right? You're not going through a third-party insurance company if you have original Medicare. You will need to add a Part D prescription drug plan, which will be through a company that offers a prescription drug plan. Those three parts on their own are what we call original Medicare. If you opt for that type of coverage, Medicare covers 80% of your covered services, and you're responsible for 20%. That's where the Medigap or Medicare supplement plans come in. That's an optional extra coverage that you can add. And what your supplement is going to do is it's going to pay your 20% of the covered benefits. Now, with this type of coverage, original Medicare with a supplement, the people who tend to opt for this type of coverage want to have the maximum choice in how to get their care. With original Medicare, you can see any doctor in the country who accepts Medicare. If the doctor takes Medicare, you can go there. You don't have to get authorizations. You don't have to get referrals. You select the doctor, make sure they take Medicare, you can go there. Anywhere in the country. And Medicare will pay 80%. You're responsible for 20%. If you have a Medigap, your Medigap policy is going to pay your 20% of covered benefits. If Medicare, the rule of thumb when you're thinking about a supplement is if Medicare pays it's 80%, your supplement is going to pay the other 20%, leaving you with low to no out-of-pocket costs. If Medicare, however, doesn't cover something, your supplement won't cover it either. Right? Your supplement does not provide any additional coverage. It's there entirely to cover what Medicare doesn't. Okay, but Medicare has to pay first or the supplement won't pay either. So for people who are going to travel a lot, or for people who have a health condition and they want to be able to go to the doctor of their choice without having to jump through a bunch of hoops, this is a really good option. Now, there is no dental or vision coverage. There will be hearing coverage. I cannot tell you off the top of my head when that's going to start. That just passed in late 2021. So if you want dental and vision coverage, you have to purchase a separate policy for that. So the downside of original Medicare is that you are going to have higher monthly premium costs. The flip side of that is that when you get care, you're going to have low to no out-of-pocket costs. Depending on which Medigap or Medicare supplement policy you choose, things are covered differently. There are, I think, 8 or 10 different Medicare supplements out there. Medicare sets what a supplement has to cover, and then there are a variety of companies offer them. And they all have different premiums. And we're going to talk about the premiums for Medigap later in the presentation. But basically with original Medicare, you have higher monthly premium costs, but low to no out-of-pocket costs. Yes, Mary.
Um, I want to make sure I'm understanding this. Is Medigap an umbrella term for all the supplemental policies?
Yes.
Okay.
And a supplement or a Medigap is specific. A lot of times people refer to any additional coverage they have as a supplement, and it's not. So for example, a Medicare Advantage plan is not a supplement. A prescription drug plan is not a supplement. The supplement or Medigap specifically is the type of coverage that covers your 20% of what Medicare doesn't cover. Okay. And we're going to look at them later in the presentation.
Thank you.
So that's kind of in a nutshell how original Medicare works. So the other option is to enroll in a Medicare Advantage plan. And these are the things that you're seeing 150 million commercials about and getting, a metric ton of mail about, right? They advertise heavily, and you're just getting, I'm sure. I talked to someone when I was first working for the Aging and Disability Resource Center who she was in tears. She was just like, there's so much, I have so many things to look at. I don't know what to do. And I told her, take all of that mail, put it in a box. Well, first I tried to tell her to throw it away, but she was not ready to do that. So I said, just put it in a box, put it away. You don't need to look at all that. And later in the presentation, I'm going to show you how to go directly to medicare.gov and see how to find a plan there so that you're looking at just the facts, ma'am, and not all of the advertising. Okay. So because that's part of what makes it overwhelming is that, you are the target of some pretty hard sells with the Medicare Advantage plans. So basically with a Medicare Advantage plan, you're joining an HMO or a PPO. For most people, this is very familiar because it's how most employer insurance works and people are used to it. The Medicare Advantage plans roll together the Part A hospital coverage, Part B doctor coverage, and Part D prescription drug plans into one policy that's offered through the third-party insurance company. Okay. The advantages here is that a Medicare Advantage plan has to cover at least what original Medicare covers, but it can offer additional coverage, such as dental, vision, and hearing, right? You have to be really careful and look at the plan details to see that you're getting what you think you're getting. But they do offer that additional coverage. They offer, oftentimes plans will offer a Silver Sneakers gym membership. There may be some transportation benefit offered through the Medicare Advantage plan. So people are attracted to this type of coverage because they want those additional benefits. With the Medicare Advantage plan, you're going to have lower monthly premium costs, but you are going to have copays and coinsurances every time you get any care, right? So if your health needs are relatively low, like you're a healthy 65 when you start on Medicare, and you've got to go to the doctor once or twice a year, this type of coverage might be quite cost effective for you because you've got the lower monthly premium costs and you have, your copays when you go to the doctor are not that bad. If you end up hospitalized, if you have higher healthcare needs, paying a premium every time you see a doctor or get a test done, it can actually add up. And sometimes, depending on people's healthcare needs, original Medicare with a supplement, despite the higher monthly premium costs, can actually end up helping keep their costs down in the long run. So this is a very, very individual decision when you're deciding between original Medicare and a Medicare Advantage plan, and it's going to depend on your budget. It's going to depend on how you like to get your health care, your basic healthcare needs at this point, and what you're looking for in terms of additional benefits. Does anybody have a question about the basic difference between original Medicare and a Medicare Advantage plan right now? Okay, so hang on to that. It's a little clearer than mud. Okay, so a little dive into the basic parts of Medicare. Part A, hospital insurance, covers your inpatient hospital stay, inpatient skilled nursing facility or rehab stay, blood up to 3 pints, home health care. And in this case, home health care doesn't mean homemaker services or personal care services. What it means is skilled nursing assistance provided in the home. So for example, if you had a fall and needed physical therapy, occupational therapy provided in the home, that's what this covers. And hospice care is also covered under Medicare Part A. Again, whether you opt for original Medicare or a Medicare Advantage plan, you are going to have Part A, and these are the basics that'll be covered. Most people don't pay a premium for Part A. If you paid into the system for at least 40 quarters or 10 years, it's going to be free. There is a deductible of $1,556 per benefit period. And it's really important to know that you can have multiple benefit periods in the same year. A benefit period is not 12 months. A benefit period starts when you use your Part A coverage. So if you're hospitalized, that sparks the beginning of a benefit period. And the benefit period continues for 60 days after that initial hospitalization or entry into rehab or whatever it is. So if you are re-hospitalized within 60 days, it's part of that same benefit period and you don't have to pay that deductible again. But if you're hospitalized 6 months later, you're in a new benefit period. So you can have multiple benefit periods in a year for Part A. That's one of the big benefits of having a Medicare supplement if you opt for Medicare, original Medicare, because most Medicare supplements cover your Part A deductible so that you won't have those out-of-pocket costs, that it would be covered by the supplement. And with the Medicare Advantage plans, you're going to have set co-pays that you pay each time you're hospitalized. Okay. So if you did not qualify for free Part A, there is a premium. You can pay the premium for Part A. The premium is quite expensive. It's over $400 a month. So for most people, that is not affordable. Most of the people that I work with who don't qualify for free Part A are either, have a disability and weren't able to work the required 40 quarters, or possibly worked, sort of in a non-traditional occupation. So if you or anyone does not qualify for free Part A, definitely they need to call the Aging and Disability Resource Center and ask for assistance from a SHIP counselor, because often we can help people get free Part A. Also, if you don't enroll in Part A when you're first eligible, there will be penalties. And there are, as I mentioned, there are some ways to potentially qualify for free Part A, even if you're not initially given it, and we can absolutely help with that. Okay, any questions about Part A before we move on to the details of Part B?
Yes, Chris.
Yes. Mm-hmm.
I was full-time employed, and I'm sure they took out FICA taxes in my younger years. But since about 2000, I've been self-employed, and I'm not sure. I mean, is there a way to check what my FICA payments are?
Yes. And so if you go on ssa.gov, there's a really handy little benefits calculator. And I can, let's go there now. So I'm going to stop sharing this, and I am going to start sharing a different screen. So bear with me for a sec while I get that set up. So sorry, this is why this is an experiment, right?
You know, I'm just so grateful for all that you're doing. Don't worry about it.
Okay, can you see the Social Security screen now?
Yes.
Okay, so we can go here. So there's a couple of things. I always scroll down to the bottom because this is where I find it easier. So here's the retirement, here's Medicare. So if you want to apply for Medicare through Social Security, you can just click right here and it'll take you to apply for how to apply online for just Medicare. Do you see this right here?
Yeah.
Okay, so that's easy. So I'm going to go back. And if we click on retirement, so here you can learn how your retirement benefit works, planning for retirement, deciding when to start. So you can go on here and it will actually show you what your specific benefits are going to be. And if you need help walking through, you can go in here and just poke around and click on these links and explore. If you need help with this, you can call us and we'll be happy to help.
Thank you. Thank you.
Understand your benefits. So it's all right here. It's actually fairly easy to get to. And like I say, if we're looking at all of this, I find I like just looking at the just the facts, ma'am. Let's just keep it simple. So I do recommend just kind of poking around on socialsecurity.gov. I helped someone who has a disability a couple of weeks ago. She didn't think that she was going to be eligible for a Social Security check. And we went in here and poked around, and because of her disability, I did the work for her while we were on the phone together, and turns out she's eligible for a lot more than she thought she was. And well, I'll just say that day gave me a lot of job satisfaction. She was very happy.
Terrific.
Okay.
Thank you.
So I'm going to go back to the presentation, and at the end, please do let me know how you found this little pause from presentation and bouncing around bit. Okay. All right. So we are back here on part A. Any other questions before we start talking about part B? Okay. So part B is the outpatient or doctor part of the coverage. It covers doctor visits, outpatient surgery and supplies, your labs, x-rays, MRIs, CAT scans, EKGs, durable medical equipment such as canes, walkers, scooters, all kinds of things are covered. Oxygen is covered under durable medical equipment under Part B. Diabetic supplies such as needles and test strips, and preventive services. Your annual visit. Medicare has some amazing preventive services. They have diabetes, they have weight loss services. So there's a lot of programs that you can access under preventive services. In 2022, the basic cost for the standard Part B premium is $170.10 per month. We do expect that to go down in 2023. Okay, 2022 saw the highest jump we've seen in a very long time. And that was in anticipation of covering an Alzheimer's drug. You may have seen this in the news. And that drug had lower costs than anticipated. I mean, when does that ever happen? So they are going to reduce the premium to reflect that cost isn't as high as expected, but they're not going to do it until next year. So for now, it's $170.10. The standard Part B deductible is $233. If you have original Medicare with a supplement, that you will have to pay the Part B deductible, and then after that, your supplement will cover all of your 20% costs. If you have a Medicare Advantage plan, they set their own deductibles, and they vary anywhere from a $0 deductible for Part B up to the full $233. The plans set their individual. It can be less than that $233. It can't be more. So for Part B, you can expect a 20% coinsurances for most covered services, as long as the doctor accepts Medicare or is in network for your plan. If they don't, then your costs may be higher. Most preventative services have a $0 copay. Mental health services and hospital outpatient services are also covered under Part B with that 20% coinsurance. I talked to somebody the other day who thought Medicare did not cover therapists or mental health providers, and it's so important to know that it does. There's also the 20% coinsurance on durable medical equipment. Any questions about the basic Part B coverage before we go on? Okay, we can always come back. Okay, so sometimes people don't know if they should enroll in Part B or not. Basically, if you are still employed and have active employer insurance, then you can opt to delay enrolling in Medicare Part B without accruing any penalties. Or if you're covered under your spouse's active employer insurance, you can continue that and enroll in Medicare when that coverage ends during a special enrollment period. That is the only time where it's really a good idea to opt out of Medicare Part B coverage, because those are the conditions under which you won't accrue penalties. Okay. COBRA is not considered active employer group health benefits. And if you think, oh, I'm covered by COBRA, I don't need to enroll in Part B now, you will accrue penalties. Okay, and we'll talk more about the penalties later. Also, if you have a retiree plan that's not active employer coverage, that's not creditable coverage for Medicare, and you will accrue penalties if you don't enroll in Medicare. Many retiree plans, including TRICARE for Life, require you to be enrolled in Medicare if you're eligible. I've actually worked with people who thought that they didn't need Medicare because they had TRICARE, and then went to get health coverage, went to get some treatment, and TRICARE was like, nope. Medicare doesn't pay, we're not paying either. So it's very important to really understand how your plan works and how it works with Medicare before you opt out of Medicare. So if you're considering that, please call us so that we can help you sort that out. We don't want anybody to think that they have the coverage they need when really they don't. So when are you exposed to a penalty? Well, if you waited too long or delayed your enrollment in Part B and you weren't covered by active employer insurance, then you are going to have penalties. The penalty for not having enrolled in Medicare Part B is 10% per year, right? So with a Part B premium right now being $170.10, that means it's a $17 per month penalty that you pay forever. So if you waited a year, if you had a year where you could have been enrolled in Medicare Part B and you weren't, and then you get yourself enrolled, instead of $170 a month, you'll be paying $187 forever. The penalty does not ever go away. Okay, so a 1-year penalty, nobody likes to have to pay extra, but a 1-year penalty isn't too bad. But if you wait longer, if you wait 10 years, your premium doubles due to the penalties. So it's very important to understand that there will be a penalty and how to avoid that. So again, I mean, my main message here is if there's anybody who's considering not enrolling in Part B, call me so I can talk you out of that, or tell you that it is a safe thing to do, and make sure you understand what you're going to need to do when your creditable coverage ends to make sure that you get Medicare during that special enrollment period. Okay. So if you've been thinking about what I explained, the difference between original Medicare and a Medigap policy, and you think you want original Medicare with a Medigap policy, it is definitely best to do that when you're first eligible for Medicare. If you want a Medicare Advantage plan and you don't have active employer insurance, you need to do that when you're first eligible. If you have or will have TRICARE for life, you're definitely going to need to be enrolled in Medicare, or if your employer or retiree plan requires it. Basically, really the only time to opt out is if you have active employer insurance. Okay.
Chris,
Yeah.
is TRICARE for Life a government program?
Yeah, it's military.
Oh, okay.
Yeah. People who've served in the military may be eligible for VA coverage, but they also may be eligible for TRICARE for Life, which is a full military insurance. So VA, and I'm just going to explain this because somebody may watch this in the future. VA coverage is not actually considered an insurance by Medicare. So if you have VA coverage, you do still need to enroll in Medicare to avoid a penalty. And I can, again, call us. We'll talk you through the implications of your decisions around Medicare and your VA coverage. The VA loves it when veterans are covered by Medicare in addition to the VA coverage, because it allows the VA to charge Medicare for the services that they provide and really preserves the resources in that system, which is chronically, underfunded for the level of need. So it's a very good thing to do. And often you may qualify for one of the cost savings programs that we're going to talk about a little bit later in the presentation that help keep those Medicare costs down for people. TRICARE for Life is a full insurance. It has a premium associated with it. And if you have TRICARE for Life, you are going to need Medicare in addition to that.
Thank you.
Okay. Medicare Part D. So if you enroll in original Medicare, if that's your choice, you're going to need to also enroll in a Medicare Part D plan. If you enroll in a Medicare Advantage plan, make sure it includes a Part D prescription drug plan. Not all of the Medicare Advantage plans do have drug coverage, but you want to make sure you have one that does. Because again, if you are not enrolled in a Medicare Part D plan, either directly or through a Medicare Advantage plan, you are going to be exposed to penalties. So the prescription drug plan is sold through private companies. They vary, they're all over the map. Okay, and I'm going to show you how to find both prescription drug plans and information about Medicare Advantage plans online at medicare.gov in just a minute. So you have to really be careful to match the particular drugs you're taking with the plan that you're enrolling in, because your costs can vary wildly depending on how that plan covers your medications. Okay. In order to be able to enroll in a prescription drug plan, you have to have either Medicare Part A or Part B. You don't actually have to have both. So for some people who, for whatever reason, didn't have one of those parts, they could still get a Part D prescription drug plan. The plans are local. They have local service areas. So if you move your plan, you may have to switch plans. Okay. And there are different plans are available in different areas of the state. And to avoid penalties, you need to make sure you have a prescription drug plan. Now, sometimes people tell me, I don't take any drugs. Why do I have to get one of these plans? Right? And I like to remind people that we have insurance not just for our current needs, but for future needs, right? It's insurance. It's for the what ifs in life, right? You never know when you're going to get hit by a bus or be exposed to COVID, right? And you may need it at that point, even if you're not taking anything right now. The lowest prescription drug plan premium that I've seen in the last month or so is around $8 a month, right? It's not a high premium. Even if you don't take any medication and you just choose the plan with the lowest premium, at least you're covered and you're not exposed to penalties in the future if your health needs do change. And really, during a global pandemic is not the time to be underinsured. Okay, so how much does the Part D cost? The deductible is the maximum allowed deductible is $485, but the plans vary wildly, anywhere from a zero deductible up to the full $485. So depending on the plan you get, your deductible may be as high as $485. It could very well be lower than that, but it can't be higher. The national base premium that you can use for like ballpark and thinking purposes is $33. But it varies. It's all over the map, right? Depending on the plan that you actually enroll in. And the co-pays and coinsurance also vary by plan and by medication. The late penalty, if you went a period of time without having a Part D prescription drug plan, is calculated as 1% of the national base premium multiplied by each month that you're not enrolled. And again, if you do accrue a penalty, you pay it forever. So I worked with somebody a while back who she became eligible for Medicare in August. She didn't realize that she had to sign up for a Part D prescription drug plan. She just didn't know she needed to do it. So she didn't get enrolled by September, October, November when she needed to. And I talked to her during Medicare open enrollment. She was past her initial enrollment period. So she had to enroll during open enrollment, and it became effective January 1st. And so she ended up having about 4 months of penalty that she had to pay, right? And so that was 33 cents times 4, it's $1.20, right? Her penalty, she was so relieved. She's like, okay, that's not so bad. I can handle that. An extra $1.20 a month for the rest of, the life of the coverage. I can handle that. But if you wait 2 years, it's going to be, almost $8 a month. So the longer you go without the coverage, the higher your penalty is going to be. But the Part D penalty isn't as steep as the Part B doctor coverage penalty. But it's nobody likes to have to pay extra, right? All right. Any questions about Part D before we move on and talk a little bit about the Medigap policies? All right. So Medigap and Supplement are used interchangeably when talking about these types of policies. If you, this was mentioned on a slide earlier, but I don't think I said it out loud. If you do have a Medicare Advantage plan, you cannot purchase a supplement. It's an either or situation. You're either choosing original Medicare with a supplement or you're choosing an Advantage plan. You can't purchase a supplement to cover your part of the Medicare Advantage plan costs. It's illegal. You can't do it. So it is there to cover your out-of-pocket costs with original Medicare. Some policies cover your copays or coinsurance. They're identified by letters and they're sold by private insurance companies. So before we go to the next, and I'm actually going to skip the next slide and we're going to go straight to the horse's mouth to Medicare.gov, and I'm going to show you where to find this information. The important thing to know about a Medigap policy is that when you first become eligible for Medicare, you have what's called a right of guaranteed issue period. When you're in that initial enrollment period, when you're first starting Medicare. During your right of guaranteed issue period, if you want a policy, the company pretty much has to give it to you, right? They cannot require a health screening. They cannot decline you based on pre-existing conditions. So if you want a Medigap policy, that's the time to get one. Okay, it's easy to change over to a Medicare Advantage plan at a later date if you decide you want that type of coverage instead. But if you do that, it's likely to be difficult, if not impossible, and definitely more expensive to get a Medigap policy again, because you will no longer have a right of guaranteed issue. Okay. If you start out with a Medicare Advantage plan and 2 or 3 years later decide, you know what, my health needs have changed. I'm tired of having to pay all these copays every time I turn around. It's like getting pecked to death by pigeons. I want to go to original Medicare with a supplement so I don't have to worry about, having, $50, $100, $300 copays every time I turn around. At that point, if you apply to a company for a Medicare supplement, they can and will require a health screening, and they can and may very well decline you based on pre-existing conditions. Okay. They can also charge you more based on your age and your diagnoses. Okay, so if you want this type of coverage, it's definitely best to do it right away. So we're gonna dive in here a little bit. I'm gonna stop sharing this screen and I'm gonna go to Medicare.gov. Sorry, I have 2 screens up and I keep forgetting which one. There we go. There we go. Can y'all see the lady with the, I don't know what these lines are supposed to be around her head?
Yep.
Okay. So number 1, Medicare scam avoidance 101 is do not ever just Google Medicare. That is a nightmare you do not want to get into. If you want to know anything about Medicare, type into your window www.medicare.gov. It will take you straight to the official website for Medicare.gov. Okay, this is the only place you want to go. When I was preparing to interview for the first job I got here at Aging Long-Term Services, I knew they were going to ask me about Medicare. So I Googled Medicare and holy cow, what a rat's nest, right? I mean, and it's mostly people who want to sell you something. And another tip is any website that wants you to provide any information at all before they will let you into the website or give you any information is something you want to click out of right away, right? You shouldn't have to do that. So we want to go straight to Medicare.gov, right? I do recommend creating an account on Medicare.gov. It's as safe as anything on the internet can be. They work really hard to keep the information secure. And it's going to make managing your Medicare a lot easier. There's a lot of great information here. So the first thing, since we're all new to Medicare, I really like their Getting Started with Medicare page. You can go here. You can learn more about the Medicare basics, basically the same information that I'm presenting here today, but presented in a slightly different format. And depending on, you know, as I mentioned before, I'm an old teacher, so sometimes you know, saying the same thing 4 or 5 different ways is going to get through to people differently. So depending on the type of learner that you are, this may, you know, be very helpful for you. Okay. Again, it has all the information about signing up for Medicare, when to sign up, how to sign up, when coverage starts, help you prepare for that. The information about the coverage options that we've just been talking about, it's all here again, right? And then I really like this section here on using Medicare. So once your Medicare starts, how do you make sure you're really getting the maximum usage out of it, right? So 5 tips for using Medicare, helpful tools. So I really recommend that people go on here and look around a little bit to make sure you really understand and you're getting the most out of your Medicare. So we're going to look right now at the Medigap policies. So I clicked up here on health and drug plans, and I'm going to go over here to find a Medicare supplement insurance or Medigap policy. I'm going to click on that. The first thing you have to do is enter your zip code, because as we mentioned before, these things are local and different plans may be available in different areas of the state. So I'm just going to put in the Santa Fe zip code because that's where we're at. It's going to ask you your age, your sex, and whether you use tobacco. And then it's going to show you what plans are available. Okay, so I'm going to back up a little bit to this under step 1, decide which plan you want, see the benefits of each plan. And this shows this handy dandy chart. The plans are identified by the letters of the alphabet, goes across the top, and the plan benefits that can be included in the plan are down the side, right? So these are the things that a plan can include. If it has a green check mark, the plan does include that benefit. So we can see that for all of the plans that are visible, there's more. Plan N is off to the side here. All of the plans cover Part A coinsurance and hospital costs. So that's that $1,556. Oh, no, the deductible's down here. Sorry, Part A deductibles down here. So this is your 20% of a hospital stay, right? All of the plans cover it. Part B copays or coinsurances, that's your 20% of a doctor visit or any of the benefits that are covered under Part B, right? So plans A through G cover all of your 20%. Plan K covers half of your 20%. So it covers 10%, you're still responsible for 10%. If you had $100 doctor visit, the full cost of the doctor visit was $100. Medicare covers $80. A plan K would cover $10 and you would have a $10 copay, right? That's kind of what that means. Plan L covers 75% with that same $100 doctor visit. Medicare covers $80. Plan L covers $15 and you have a $5 copay. That's how you interpret the percentages that are in these. So K and L don't cover the full cost of these benefits. They cover that percentage, right? Same with blood, same with hospice. Okay, here's where, you know, if you're just talking about doctor visits, the 50% or 75% in particular are not that bad. But if you're talking a hospice stay, or you're talking a stay in a skilled nursing facility, that can really add up. Okay, I'm going to have to put you on pause for a minute because I have a walk-in. So hold on just a moment. Okay, I'm back. So we're still looking at the Medigap policies, right? So this is where you go to look, and basically when I'm working with somebody who's considering original Medicare with a supplement, I recommend spending some quality time with this chart. You want to know what benefits are covered, and then you want to start by going, okay, well, the supplements that look like they're most likely to meet my needs, and then you're going to look at who offers those and the pricing based on the plan that you're interested in. The plan that covers the most at this point is definitely Plan G, right? It has the most benefits, but it's also going to have the highest premium. So if we go back over here and start looking at this a little bit, and now we're back where we started from, and I'm not going to fill in this part up here. I'm just going to go down to a Plan G so we can explore this a little bit. Because there's one other really important thing that I want to give you a heads up about here. You can see that the premiums range from $92 to $774 a month. That's, you know, that's ridiculous. I think we can all agree. And I'm going to tell you why there's such a wide variation. Okay, so if we're going to look over here at, I'm going to click on the green view policies button. And this is going to show us the companies that offer Plan G in New Mexico. Okay. So AARP offers a plan. They're the one that show up first. The premium is $208 to $259 a month. Here's the key thing that you want to look at. This is an issue-aged pricing plan. And what this means is the premium depends on the age you are when you enroll in the policy. Okay. And you can see here it says premiums are low for younger buyers and won't change as you get older. Okay. So if you start out with a premium, with a plan whose premium is, you know, $210, that's the premium you're going to be paying for the life of the policy, more or less. They're allowed to raise the premiums based on inflation or the cost of living, but you're not going to see big increases in your premium from year to year. So here's another one. It's also issue aged. Ascendo is the next company that offers a plan. This is an attained age pricing. Sorry, this is my little window. There's no good place to put it. With attained age pricing, premiums are low for younger buyers, but go up as you get older and can eventually become the most expensive. I talk to people who, most people who've enrolled in supplement don't really understand these different pricing structures. And if you go through, I mean, they just may or may not have been given the information about how the pricing works on these. Almost all of the plans are attained age pricing. And with an attained age pricing plan, often they'll tell you, you know, you're not going to have a premium hike for the first 10 years, but then after that, it'll start going up. I mean, they can raise the premiums every year, significantly. And I've talked to a number of people who have had to give up their supplement after paying into it for years because they could just no longer afford it. There is a third pricing structure. Sorry, I'm scrolling through for the, that's called community pricing. It's based on a risk pool. And again, like the issue age pricing, the premium may start out higher, but it doesn't change significantly from year to year. So it looks like it used to be that United Healthcare had the community pricing policy, but it looks like they've switched it to issue age since the last time I looked at the plan finder, which was not that long ago. Okay, so if you're considering a Medigap policy, these are things to consider. Now, if you're going through the Retiree Healthcare Authority, you don't have to worry about any of this. They offer their one plan. It's a community pricing plan. That's why the premium is as high as it is, because people can actually, unlike if you just buy your supplement directly from a Medicare supplement provider instead of going through the Retiree Healthcare Authority, you can actually change back and forth between Medicare Advantage plans and the Medicare with Medigap if you're getting your insurance through the Retiree Healthcare Authority in a way that you cannot do otherwise. And that's why the premium is higher, because it encompasses people at all different levels of health, right? Okay, so since we're here, let's just take a look at how to use the plan finder on Medicare.gov. To get back here, I just clicked on the Medicare.gov, right? It takes you back to the home page every time, right? Just a little navigation tip. So if we want to look at health and drug plans, I'm just going to click on Find Health and Drug Plans over here. We can continue without logging in. You do not have to create an account in order to look at the information that's here. So we're going to continue without logging in. So let's just take a look at the Medicare Advantage plans. Again, you have to enter your zip code because plans vary according to location. So let's just do 88. Let's do a different area of the state in Chavez County. I don't know if any of you are from there, but let's just look at that. It's going to ask if you get any assistance, right? Because different plans are available. I'm just going to click I'm not sure. And then we're going to continue without logging in. I'm going to put in a couple of common medications because I want you to see how important that is. Okay. And I'm just going to put in a common blood pressure medication, lisinopril, and I'm going to leave it at the standard dosage. And let's do metformin. Okay. Well, I'm just trying to think of some really common things. And maybe levothyroxine, another. Add it in. Okay. It's going to ask you to put in some pharmacies. Now, you're not committing to a pharmacy here. You are just seeing how the costs may vary depending on which pharmacy you use. I always fill all 5 slots. So I'm going to put in mail order. I always want to see if it's going to save me money to get my drugs through mail order. I'm going to put in Walgreens. I always ask people where they shop because sometimes those have great prices. And let's see, let's do the local one. Okay, so that is done. Okay. All right, and so this shows that we have 10 of 21 plans, or there's 21 plans available in this area. I am going to go under the plan benefits, and I'm going to say, yeah, I want to know if it covers vision, dental, and hearing. You can also screen it for plans that have transportation benefits or fitness benefits, but I'm not going to do that right now. I'm not going to look for a particular carrier, but I always want to make sure that the plans I'm looking at include drug coverage. So I hit apply there. And that brings us down to 13 Medicare Advantage plans. All right, so we have a lot fewer plans to look at once we've made sure they include those key pieces of coverage. So I'm going to go down here. The first plan is a Medicare Advantage plan, has a 0 monthly premium. So you're still paying your $170.10 for your Medicare Part B premium, but the plan does not have any additional premium. Okay, it doesn't have any deductibles for health or drugs. It says here that it has vision, dental, and hearing, right? You can get some just basic information here on this first, I call this the face sheet. You're going to have a $10 copay for a primary doctor, a $45 copay for a specialist. But in order to see how it really covers things, you have to look at the plan details. So I'm going to click on this plan details button. And I'm just going to scroll down. It tells us that same information again, that there's no additional premium beyond your standard Part B premium. No deductible for health or drugs. The $10 copay for your primary doctor visit. If you're in network, you can still see a doctor who's out of network, but you're going to pay $35 instead of $10. Same with a specialist, $45 copay in network, $70 if you choose to see a doctor that's out of network. I'm going to pause you again because I have another walk-in, so bear with me for a moment. Okay, thank you again for your patience. So going down here, you can look and you can see, we're not going to go over this in excruciating detail, but you can see what you can expect as a copay for all of the diagnostic tests and procedures, labs, MRIs, everything is listed here with what you can expect in terms of your costs. And I'm going to go down here to look at the drug coverage. This plan covers those medications pretty well. I'm seeing a 0 copay for all of the medications, right? So this, boy, if you were taking metformin, lisinopril, and levothyroxine, this looks like it would be a pretty good plan in terms of drug coverage. The next thing that you really want to look at is the extra benefits. It's going to show how it, remember there was a green check mark next to dental, vision, and hearing. But this is going to show you actually how those are covered. So with this plan, a hearing exam has a 0 copay, but it doesn't cover fittings or evaluations. And for hearing aids, if you get them in network, you can expect a copay between $375 and $1,425. Okay. This plan covers preventive dental. So for your exam, cleaning, fluoride treatment, and dental x-rays, that's going to be covered with a 0 copay. But it does not cover all of the comprehensive dental services. For example, non-routine services are not covered. Diagnostic services are covered with a zero copay, and so is restorative services, and that would be like fillings. But endodontics, periodontics, and extractions are not covered. So if you needed a root canal, if you're having trouble with gum disease, or if you needed a tooth pulled, that is not covered by this plan. Okay. It does cover prosthodontics. So if you need dentures, that would be covered. So just because there's a green check mark next to dental, it does not mean all of your dental needs are going to be covered by the plan. You really have to look at the details before you make a decision about that and make sure you know what is covered by the plan. And then the same with eye exams. So the vision, this plan does cover eye exams, contact lenses, and if you're getting new glasses. But if you just need to replace the frame or you just need to replace the lenses, it's not covered. Right? So it's really interesting. You really have to look. And anytime there's one of these pluses, you can click on it and it shows you more information. Right? So with this plan, chiropractic, acupuncture, massage, alternative therapies are not covered at all. Nor is any of these. It does have some fitness benefit, does have some over-the-counter drug benefit. So you can go in and you can look at the details of plans that you're considering on the Medicare.gov website. And if you, I'm thinking about adding a full workshop just on this. If you think that's a good idea, let me know in the chat. And we're going to return to our regularly scheduled presentation. All right. There we go. So that's basically, we're going to skip this slide because, whoops, I don't think I actually shared that, did I? Let's do that. Okay. Are we, can you see the Medigap? Okay, good. Mary, I'm so glad you decided to stay on camera. I mean, Laura, sorry. All right. So we've already kind of taken a dive into Medigap policies through the Medicare Plan Finder, but basically, again, back to the slide, Medicare Advantage plans, it's super important to know that they are not a separate Medicare benefit. They are a different way to get your Medicare. If you enroll in a Medicare Advantage plan, you still have Medicare, right? You have to have Medicare A and B, and the plan is a Medicare plan. It's run by a private insurance company that contract with Medicare. Most of them include, they bundle together Part A, Part B, and Part D. Again, you have to make sure if you're looking at the plan that it does include Part D because they don't always. Okay. The deductible for each plan is different. The monthly premium for each plan is different. The plan we looked at just now in the Plan Finder had a 0 monthly premium for the plan, in addition to that $170.10 that you pay for Medicare Part B. Some of the plans, the premiums go up to $200 a month. Okay, so there's a wide variation in the plans. The premium and the benefits don't necessarily coincide. Right, so you can't assume that just because a plan has a low premium, it's not as good as a plan that has a higher premium. It really pays to go in and really look at the details of the plan benefits. That's one of the things that the SHIP counselors are here to help you do. Copays and coinsurances vary wildly depending on the plan. When you first enroll in Medicare, you sign up for a plan. You can change your Medicare Advantage plan or your Part D plan if you opt for original Medicare. You can change those yearly during Medicare's fall open enrollment period. It's the same every year. It runs from October 15th to December 7th. And you'll get another flood every year. You'll get another flood of mail and solicitations and advertising. from the companies trying to, get you to enroll in their plan. My husband hates it when Medicare open enrollment comes around because I just sit there and yell at the TV because not all of the advertising is what it should be. So we here at the Aging and Long-Term Services Department and the Aging and Disability Resource Center, every fall open enrollment from October 15th to December 7th, that's all I do is help people look at their plan options. We devote our whole staff to that during Medicare open enrollment. So just remember that if you need help with this, as you live with your Medicare coverage, that's what we're here for. Okay. So basically, when we look at Medicare Advantage plans, these are the types that can be offered: an HMO or health maintenance organization, a PPO or preferred provider organization. By far, the vast majority of plans here in New Mexico are either HMOs or PPOs. Other options are private fee-for-service or PFFS, special needs plans or SNPs, we call them. Those are for people who either qualify for Medicaid in addition to Medicare, or have a certain chronic health condition that qualifies them for a special needs plan. And then there are also medical savings accounts, right? I'm not sure there are any of those available in New Mexico at this time. But if you go on the plan finder, you're going to see, right? But this is just a shortcut for what those different types of plans are. They have to include the services that are covered by Medicare Part A and Part B, and they may include additional benefits, such as the prescription drug coverage, vision, hearing, or dental coverage, fitness programs, over-the-counter drug benefits, transportation. Some of them have begun offering caregiver support. There's a variety of things that the Medicare Advantage plan may offer in addition to what's strictly covered under Medicare Part A and Part B. Okay. Medicare and You is your handbook for how Medicare works and what's covered. You may get one in the mail when you turn 65. You can also opt to download it, and it's always available on Medicare.gov. So if you didn't get your book or you can't find it, you can go to Medicare.gov and either just look through it or download an electronic version. And we already looked through this, getting started with Medicare information on the Medicare website. I really do recommend taking a peek, having another option for where to refer for information. It's important to know that there are some programs that are designed to help make Medicare more affordable. That $170 a month premium for Medicare Part B is really, a blow to the budget for low-income people or people on a fixed income. So there's a Medicaid program called the Medicare Savings Program, or MSP, that's designed to help keep Medicare affordable for people on limited incomes. Again, it is a Medicaid program, so it is based on income. This program looks at income only, not at assets for eligibility. And basically, if your income as an individual is $1,549 or less, you're likely to qualify for one of these programs that at the very least is going to pay that Medicare Part B premium on your behalf. You can apply for the MSP online at www.yes.state.nm.us. You can call us at 800-432-2080, And we can either walk you through how to do that yourself. If you don't have a computer or you're not comfortable with computers and you want somebody to assist you with that application, I'm happy to do that. It takes about 15 minutes. It's pretty quick and easy. For a couple, the income limit to be eligible for the MSP is $2,080. So that is a really important program to help keep Medicare costs down if you are on limited income. Also, another Medicaid program that works with Medicare is the home and community-based waiver. This is a Medicaid program that helps pay for in-home caregiving assistance. So particularly for people who maybe had Medicaid before and were receiving in-home caregiving services through the Adult Magi Medicaid program and now are Medicare eligible, whether it's because they've been on disability for 2 years or because they're turning 65, it's really important to know that you do have to register for the home and community-based waiver through our office. The only way to get this benefit process started is by calling the ADRC at 800-432-2080. And this Medicaid program works with Medicare. Medicare is still your primary health insurance, but the home and community-based waiver provides the in-home caregiving portion of your care. For people who are in a skilled nursing facility or rehab, there's another waiver called the institutional care waiver that works. It's designed to dovetail in with Medicare. Medicare pays the first 21 days of a skilled nursing facility stay at 100%. But after that, it drops down to 80%. And your 20% of a day in a skilled nursing facility is quite a hefty copay, right? So for people who have a limited income and are going to qualify, basically for this benefit, it's $2,345, I think. Don't quote me on that. It's around that zone or less a month. Then you're going to qualify financially for the institutional care waiver if you're in a skilled nursing facility. Before we move on, any questions about how Medicaid works with Medicare? These are the main programs: the MSP, the home and community-based waiver, and the institutional care waiver. And the main thing you need to remember about that is if you have questions or need help with it, just call us at 1-800-432-2080. You can also chat with one of our web agents if you go to our website, www.nmaging.state.nm.us, and we'll go poke around there in a minute. Oh, like right now. So I'm going to stop sharing this so that we can get the real deal. I appreciate your patience as always. Okie dokes. So here we are. I really like our website. You can see on our website, you can just click. If you want more information about the Medicaid waiver, you just click right here. You can report, you can fill out an adult protective services report. If you think someone, yourself, someone in your family, someone in your community is being harmed, you can report it right online. You can get reverse mortgage education through our Heconomics app right here online. Whoops. Hang on. What is going? What are you saying? Let me make sure I am where I think I am. I'm gonna stop the share and get back in here. Sorry. As I mentioned before, this is an experiment, and I'm going to need you to tell me at the end whether you think it was a good one. Okay, so here we are on the website. There we go. There's also all kinds of different information here. The Ombudsman program, you can find out about elder rights and legal resources, senior services through the senior centers, more information about the Medicaid waiver. And here's what I want to show you. If you go all the way down to the very bottom, above the C, in the ACL logo here is the YouTube logo. This is the link to our Aging and Long-Term Service Department's YouTube channel. So if you click on that, it's going to take you directly to the Aging and Long-Term Services Department YouTube channel. And here you can see the different informational videos we've posted. So we did an interview with Sage Albuquerque, with Havens Levitt regarding LGBTQ elders for Pride Month. You can watch those videos there. That was really fun. She's awesome. You can get information about the Ombudsman's volunteer program. You can see here this month's Medicare Minute. You might recognize this person right here. Was on hospice coverage. Here's the Medicare 101 from last month, right? Just there's a variety of things here that, you know, you can poke around and look at. And this is where this video is going to show up after we're done and I get it posted. Okay. So back here. So I recommend, you know, taking some time. The other thing I want to show you is if you want to find out about what's going on, future workshops and events, you can always come here and click on upcoming events, and that's where you'll find the links, the calendar and the links. Also, I want to direct you to the Conference on Aging. It's coming up in August, and it is, you know, has a lot of information, just a ton of information. So check it out. That's my pitch for all things aging and long-term services. All right, I'm going back over here.
Thank you so much.
Oh, good. Well, I'm glad you're enjoying our little, you know, tiptoe through the tulips here.
You're just
Okay.
excellent.
Oh, thank you. All right, now we're summing up because we are getting close to the end of our time. Basically, when you call our number 800-432-2080, you're going to reach the Aging and Disability Resource Center. When you call, you're going to speak to someone whose job title is Options Counselor, and they're going to ask, you know, how they can help you. Because basically, the Aging and Disability Resource Center is not a direct service provider. What we do here is we're the call center for the state, and we, you know, work to help people identify their needs and then connect them with the resources to meet those needs. And that can be federal, it can be state, it can be local, public, private. We have a vast network of resources that we really try to help connect people with. Another big thing is if you're in need of in-home caregiving services, the registration for that benefit has to start at the ADRC. People are confused all the time. They've applied directly through Medicaid and been denied, and they don't understand why. And it's because you can't apply directly for Medicaid for that particular benefit. It has to come through us first. We have, as I mentioned, this access to a ton of resources through the network of care. We also offer short-term assistance with a variety of needs. We help people with paperwork, We help people navigate systems when they're trying to get assistance and benefits. All of the SHIP program, whether it's helping you find the right plan for you, helping apply for benefits like the MSP or other benefits, are available through that same portal through the Aging and Disability Resource Center. Also, that's how you reach Senior Medicare Patrol. We have a prescription drug assistance program that even with Medicare coverage, often people find that the copay for their medication may stretch their budget really uncomfortably. So our prescription drug assistance program helps connect people with pharmaceutical companies' patient assistance program to help them get their medications for free or low cost. We really don't want anyone not taking their medication as prescribed or rationing it because they can't afford it. So again, all of those resources and more are available by calling 800-432-2080 or through live chat on our website, www.nmaging.state.nm.us. Okay, I want to pitch the Affordable Connectivity Program. If you don't know about this, this is a national government program through the FCC that helps pay for internet costs for limited income people. Okay, it's a great program. Basically, anybody who qualifies for Medicaid is going to qualify for affordable connectivity. It's going to give you $30 a month towards your internet costs. And depending on which program you select, it may also help you get equipment like a laptop, tablet, or desktop computer. It's a great, great program, and not enough people know about it. If you need help with this, even though it is not Medicare or Medicaid, call me and I will help you with it. If you do want to apply for the MSP, the Medicaid website is www.yes.state.nm. I'm not going to go live with this one because basically we can't get any further than this without actually creating an account and logging in. But it's very easy to go into this account to this website and apply for an MSP. If you don't feel comfortable doing that and you want support and assistance with it, we are more than happy to help. Just call us and we can. I'm a whiz at this stage of the game, and we can get her done in 15 minutes. Okay. Any questions about these other programs that I've talked about before we kind of go over a few important COVID coverages with Medicare and then wrap up? Okay. It's important to know that with Medicare, COVID-19 testing is covered. Also, the antibody treatment, if you do contract COVID, is covered. Okay, with no cost sharing, no deductible, no coinsurance, and no copayment. And this is the case whether you have original Medicare or a Medicare Advantage plan. Okay. Telehealth is covered. It's interesting. I haven't had an update about this, so telehealth continues to be covered. Prior to the pandemic, telehealth was not generally covered under Medicare. You had to, it was only in specific cases. Medicare expanded to include telehealth coverage during the pandemic, and I know that CMS wants to make that expansion permanent. At this point, it has not been made permanent, but it is continuing. Okay, so if you ever have questions about that, you're welcome to call us because we will either have the answer or we'll get it for you. Medicare Advantage plans sometimes in the past have given people a little trouble with this. If you have any issues, another thing that the SHIP program does is help people resolve coverage issues. Okay, so if you're starting on Medicare and something that you think should be covered is being denied and you need help with an appeal, or you need help, you know, finding out what should be covered, just call us. We're happy to help with those kinds of things. For example, you know, we worked with a number of people whose Medicare Advantage plans were denying the telehealth visit during the pandemic, and we were able to help them get those problems resolved. Obviously, the COVID-19 vaccine is covered as well as the booster. I want to make sure people know where to go to get a new immunization record if they lose their vaccine card. That website is www.vaxviewNM.org. Okay. And again, COVID-19 vaccine and boosters are covered by Medicare, no matter whether you have original Medicare or a Medicare Advantage plan. If you go to get a shot, they will ask for your Medicare card because they will charge Medicare for the administration costs of the vaccine, but you should have no copays or coinsurances. Another thing that was expanded during COVID-19 is the ability to get 3 months of prescription drugs at a time from your local pharmacy. Prior to the pandemic, in order to get 3 months of your medication at a time, you had to go through mail order. During the pandemic, they allowed people to pick up 3 months at a time from their local pharmacy. That is still in place. I don't know if that's going to be a permanent change or not, but it is still in place right now. Of course, the exception to that is, you know, any drug that it's not safe to issue 3 months worth at a time. Okay. Commonly, that's opioids. All right. You did it. You survived Medicare 101. Does anybody have any questions?
Yeah, I just want to check that I understood correctly, that once I enroll, then I can change a plan during the fall enrollment period,
Yeah,
the next
exactly.
fall.
So
Okay.
every year, every Medicare beneficiary has the option to change their prescription drug plan or their Medicare Advantage plan during fall open enrollment. And it's really important to take advantage of that, to at least review your coverage, because a plan that worked for you perfectly well may have changes. Your health may have changed. Your doctors may have changed. You know, there's things that change during the course of a year. And also the plan can change what drugs are on its formulary, what they can change the copays. So you really need to review that every year. And then take advantage of open enrollment to shop around and see if you can find a plan that better meets your needs and reduces your costs. Just by changing drug plans, I have helped people save, I mean, really a stunning amount of money during fall open enrollment. I think the highest was like $8,000 a year.
Wow.
Right? Just by changing their prescription drug plan. And so it really is a good thing to do. Also, watch our website. We do a workshop in the fall called Making the Most of Medicare, Preparing for Fall Open Enrollment, to just, you know, kind of guide you through what you need to do, what to look out for, and how to take advantage of that opportunity. So thank you for bringing that up. Let me pitch that a little bit.
Thank you. And really, you're just wonderful at what you do.
Oh, thank you so much. You know, I think I've told you before that I'm an old teacher, and you know, that never goes away. Thanks for letting me know I still have my teacher chops.
Yeah,
Indeed.
Chris, this was fabulous. I really appreciate you putting the time in. I know you, I guess, do this every month, and it sounds like, you know, you're on board with it. You make it purposeful each month. And I liked how you kind of went off screen to talk about and show us other things during the
Mhm.
appropriate time in the presentation. I think that was really helpful. I think that would be something future presentations should include.
All right, that's a keeper, and I'll work on how to. I felt like it went fairly
It did.
smoothly, because having somebody yak at you for an hour is pretty
Mhm.
rough. But actually showing you how to do something, I like to do what I call parallel play, like when I'm working with a beneficiary and we're looking at plans, if they have their computer, I ask them to get on at the same time so that we can go through it together so that you end up being able to do it yourself. Because our bottom line here at the Aging and Long-Term Services Department is empowering people, right? And the more knowledge you have, the more you're able to do for yourself and maintain your independence, and the better off you're going to be. Okay, awesome. Thank you for that feedback. So again, here's my contact information. I put it in the chat earlier, but here you have it again. Chris with a K, Winterowd, WINTEROWD at state.nm.us. You are
Northeast region.
Yeah, so I'm technically, my territory of the state is the Northeast, but I am not gonna turn you away if you're not from the Northeast. And you can also call me directly at 505-470-4443. I gotta warn you, I hardly ever answer my phone live because I'm almost always doing something, but I return calls as quickly as I can. And
So Chris, can I just ask a
Mhm.
question? So from what I understood, I applied for Medicare too early, so I need to go back to do that and get that completed. And then I need to, then that's what I guess I have to figure out is, do I need the Medigap or do I need the Advantage through the New Mexico retiree? Is what I've got to figure out.
Right. And if you want to have a conversation with me about that, Laura, give me a call or send me an email and I'll
Okay.
be happy to set up a time to
Alright.
do that.
All right, I may do that because according to my application for the retiree stuff, it has to have it in by June 27th. So I got to get it done,
Yeah.
I guess.
Yeah. Well, in the longer,
Is it?
people get really overwhelmed with the Medicare decisions because it
Mhm.
feels so like life or death, right?
Right.
So one of the things that I aim to do is, number one, give you some perspective on that. You can change every year, right? Yes, this initial decision is important. And for most people, the most important part of the decision is the decision about whether you're going to go with original Medicare with a Medigap or an Advantage one. Because changing that later is, if you decide later you want original Medicare with a Medigap, that can be really difficult. In your case, going through the Retiree Healthcare Authority, you actually have that option, right? So that takes that pressure off even more.
That's
So,
good to
and
know because I
knowing
did
that-
not realize that.
Yeah, at the most, the longest you're going to be stuck with anything is a year. And it could very well be less than that, particularly if you qualify for Medicaid. People who qualify for one of the Medicare savings programs can actually change their coverage quarterly.
Oh,
People who are not low income can only change during Medicare open enrollment. So, okay, so I already showed you how to get to our YouTube channel from our website, the NM Aging website, using that little YouTube icon just above the C in ACL. We do put things up there regularly. CMS sends us what's called the Medicare Minute every month, and I really try to get a video about that up every month. And it can be, it's about a variety of topics of interest to Medicare beneficiaries. And also on Facebook, follow us on Facebook. There's a lot of information that we put out on Facebook. So if you happen to still be on Facebook, that's a good thing to do, is to look for you just search for New Mexico Aging and Long-Term Services Department and you can follow us. And that's my next slide that I just did in advance. Okay, I don't actually have a current survey, so I'm going to skip past that. Can stop sharing. All right, well, we are done. Wow, exactly on time. That never happens. Thank you so much for joining me today for Medicare
Thank
101.
you.
I
Thank
really
you.
appreciate it. I do appreciate your feedback, and I am happy to talk with you if you want to get in touch with me either by phone at 505-470-4443. You can reach the ADRC at 800-432-2080, or if you want to shoot me an email. Any
Thank you.
last questions before we end?
Only what I put in the chat. Thank you very much.
Oh,
Yes.
Okay.
Thank you, thank you.
So the Medicare 101 is the whatever this Wednesday is, the third, fourth Wednesday, I think, of the month, every month. And
Oh.
again, on our website, you can go under upcoming events and it'll
Mhm.
show you when the next one is. We do it monthly. We do it, I should say we do it monthly through September. We don't do it during fall open enrollment.
Fine.
Okay, but the recorded versions are always available on our website. Each one is a
Great.
little bit different because it depends on who is in the presentation. So different things are emphasized.
Thank you.
You're welcome. Have a
Thank you
wonderful
so
day.
much.
You
Thank
too.
you.
Appreciate
Bye.
it.
Bye-bye.